Physicians at Baptist Hospital Memphis recently performed the area's first surgery using Edwards-Sapien trans-catheter heart valve technology. By using the catheter, doctors can avoid open heart surgery. Joining us on today's Heart of the Matter with details is cardiac surgeon Brad Wolf of the Cardiovascular Surgery Clinic at Baptist Memphis. Thanks for joining us, Doctor.
Thank you, Joe. Great to be here.
What is the trans-catheter valve replacement surgery, and who are candidates for the procedure?
This is a new way to replace your aortic valve, where now, rather than doing open heart surgery where we used to have to open the chest to perform this valve replacement, we can now replace your valve through a very small incision in the groin, going up percutaneously through your femoral artery to replace the valve. Candidates for this surgery would be patients who are not good candidates for an open procedure, the elderly, patients who have severe lung disease, patients who have had other major surgeries that cause scarring in the chest, or perhaps those patients who have even had a valve replacement done in the past and need a redo heart operation, are generally patients that we do these on.
How do you determine who the best candidates are?
When patients come into our clinic for evaluation for this new percutaneous valve, each of these patients will undergo several tests, one being an echocardiogram to evaluate the size of the patient's valve, the next being a CAT scan to evaluate the patient's arteries, which is where we'll be placing the valve through, and the next test is actually a cardiac catheterization to determine whether or not the patient has any significant disease in other areas of the heart that would prevent us from doing this procedure on them. Based on the evaluation from those specific tests, we then decide if you are a candidate or not. And if you are, then that's when we further bring you into the operating room to proceed with the procedure.
Does this process have FDA approval, and how long have doctors been performing this procedure?
This procedure just got FDA approval a couple of months ago. Doctors in Europe have been doing the procedure for over 5 years with excellent results, and doctors in the United States have been doing the procedure for the last several years through various studies. And once FDA approval was gained, then we started doing the procedure here at Baptist, and that was in early January.
What kind of specialized training do doctors who perform the surgery get first?
We went to New York to Columbia Presbyterian Hospital, which is one of the training sites in the United States, and we spent 3 days at that hospital getting intensive training, both academic as well as hands-on training to learn how to deploy the device. And then when we started doing the procedure, Edwards, who's the company that sells the valve, has proctors come in, and they did the first 5 cases with us, and once that was completed, then we're on our own doing the procedure. Of course, we've been doing open procedures as well as other types of percutaneous aneurysm replacements for many years, so it was not a big stretch for us to do this type of procedure at Baptist.
What is the recovery time and outlook for patients who get the procedure?
The recovery time has really been amazing with this procedure. As we've mentioned before, you don't have to make an incision in the chest. It's a very small incision in the groin, and most people are up walking the first day and go home the second day after the procedure. The outlook has just been great. These are patients who are extremely sick when we start, very short of breath, having a lot of chest pain, can barely walk across the room. We've had patients now that are driving and back to work and just doing wonderful after this procedure.
Dr. Brad Wolf of the Cardiovascular Surgery Clinic, thank you for joining us today on Smart Medicine.
Thank you. Thank you for having me. Great to be here.
If you have additional questions about the trans-catheter heart valve procedure, you can get more information by calling this number, 901-226-BEAT. That's 226-2338.